Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Non-Hodgkin's lymphoma. Introduction. Non-Hodgkin's lymphoma happens when cells in the immune system become abnormal and begin to make copies of themselves in an uncontrollable way. Non-Hodgkin's lymphoma is highly treatable. Most people diagnosed with non-Hodgkin's lymphoma can now be cured, or their disease can be controlled for many years. This program explains what non-Hodgkin's lymphoma is. It talks about its causes, symptoms, and treatment options. Anatomy. The immune system helps your body fight infections. The lymphatic system is part of the immune system. Lymph is a nearly clear fluid produced by the body that drains waste from cells. It travels through the lymphatic system, which is made up of channels and lymph nodes in the neck, chest, underarm, groin, and belly. Lymph nodes contain immune system cells that act as a barrier, stopping bacteria and viruses from attacking the body. These cells are divided into two very broad categories, known as B and T cells. Lymph nodes are connected by special channels called lymph vessels. These channels are spread out over most of the body like blood vessels. The lymphatic system drains excess fluids and waste. Other parts of the body also contain lymphatic tissue, including the tonsils, thymus, spleen, stomach, small intestine. Non-Hodgkin's lymphoma and causes. Non-Hodgkin's disease is a type of lymphoma. Lymphomas are cancers that affect the lymphocytes, or white blood cells. They develop in the lymphatic system from the B and T type of immune system cells. Normal cells in the body grow and die in a controlled way. In non-Hodgkin's lymphoma, cells in the lymphatic system begin growing abnormally and don't die when they are supposed to. They may grow into a lump known as a tumor. The tumor can start nearly anywhere in the body. Cells contain hereditary or genetic materials called chromosomes. Chromosomes control the growth of cells. Non-Hodgkin's lymphoma always arises from changes that happen in the chromosomes. When the chromosomes in a cell become abnormal, the cell can lose its ability to control its growth. Sudden changes in genetic material can happen for a variety of reasons. These changes are sometimes inherited. Changes in chromosomes may also happen as a result of exposure to infections, drugs, tobacco, chemicals, or other factors. Certain infections raise a person's risk of developing non-Hodgkin's lymphoma. Some infections that raise your risk of non-Hodgkin's lymphoma include human immunodeficiency virus, also known as HIV, Epstein-Barr virus, also known as EBV, hepatitis C virus. Other risk factors include medications that suppress your immune system, chemicals used to kill insects and weeds, age. As we grow older, our risk can also increase. Lymphoma is classified as Hodgkin's or non-Hodgkin's. Non-Hodgkin's lymphoma is a group of cancers. Diffuse large B-cell lymphoma and follicular lymphoma are the most common types. Lymphoma that grows slowly are called indolent or low-grade lymphomas. They usually cause few or no symptoms. Those that grow quickly are called aggressive or high-grade lymphomas, and they provoke more severe symptoms. Low-grade lymphoma can become aggressive over time.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Signs and symptoms. A common symptom of non-Hodgkin's lymphoma is a painless swelling of the lymph nodes in the neck, underarm, or groin. However, most swollen lymph nodes happen because of localized infection and are not because of lymphoma. Other common symptoms include fever, severe night sweats, weakness, weight loss without drying. Other symptoms may include abdominal pain, fullness or swelling, chest pain, cough, difficulty breathing, fatigue. These symptoms may not be caused by non-Hodgkin's lymphoma. Common problems like infections or the flu can cause similar symptoms. Make sure to see a healthcare provider if your symptoms last more than 2 weeks. Diagnosis. Your healthcare provider may perform a physical exam to check your lymph nodes, spleen, or liver for swelling. The provider may order a complete blood count and check for other cells and substances such as LDH. A complete blood count can give information about the quantity and quality of your white blood cells, or WBC. LDH is a test for lactate dehydrogenase and is measured because lymphoma may cause a high level of LDH. Your healthcare provider may order other tests such as a CT scan, MRI scan, PET scan, chest x-rays, and a lymph node biopsy. The only way to diagnose non-Hodgkin's lymphoma is with a biopsy. There are several different kinds of biopsies. In a fine needle biopsy, a thin needle may be inserted in a lymph node and fluid and tissue samples taken. This type of biopsy might not be able to diagnose non-Hodgkin's lymphoma because the sample is small. In an incisional biopsy, a small part of a lymph node is taken through an incision. In an excisional biopsy, an entire lymph node and some surrounding tissue is removed through an incision. This type of biopsy is the best at getting a good sample for diagnosis. Staging. A stage describes how widely the disease has spread. Treatment can be recommended based on the stage of the cancer. Non-Hodgkin's lymphoma often first shows up in a lymph node and can spread to other body parts, such as the bone, liver, or lungs. Staging can involve CT scans, MRIs, PET scans, and a bone marrow biopsy. A bone marrow biopsy uses a thick needle inserted into the bone under local anesthesia or pain medicine. Your healthcare provider may also recommend biopsies of the other lymph nodes, the liver, or other tissue. Stages are usually described using the numbers 1 through 4. A lower number indicates an earlier stage. This tells you how far the lymphoma has spread in the body. In stage 1, the cancer cells are in a group of lymph nodes or a lymph node region. In stage 2, the cancer cells are in 2 lymph node groups or 1 organ and the lymph nodes nearby. The cancer cells are in one part of the body, either above or below the diaphragm. In stage 3, the cancer cells have spread to lymph nodes both above and below the diaphragm. The spleen may also be affected by cancer. In stage 4, cancer cells have spread to multiple parts of a tissue or organ. It may be found in the bone, liver, or lungs. The disease is considered recurrent if it returns after treatment. In addition to these stage numbers, your healthcare provider may also describe the stage as A or B, depending on whether or not you have some specific symptoms. A. You have not had weight loss, drenching night sweats, or fevers. B. You have had weight loss, drenching night sweats, itching, or fevers. Patients with A symptoms tend to do better than patients with B symptoms. Treatment. Treatment for non-Hodgkin's lymphoma aims at killing as many abnormal cells as possible. Your options for treatment depend on many different factors. Your healthcare provider will discuss your treatment options with you. What treatments are right for you depends on the type, stage, and location of non-Hodgkin's lymphoma, the size of the tumor, your symptoms, age, and general health. Treatment for non-Hodgkin's lymphoma may include radiation therapy, chemotherapy, biological therapy, targeted therapy, and stem cell transplantation. Sometimes a combination of treatments may be used. People without symptoms may not need treatment right away. They may only need regular checkups. This is called watchful waiting. Discuss with your healthcare provider what treatments you need. Chemotherapy, also called chemo for short, is the use of drugs to kill cancer cells. To treat non-Hodgkin's lymphoma, the healthcare provider prescribes a combination of drugs that work together. These are called chemotherapy regimens. Chemo usually consists of a treatment period followed by a rest period. There are many different kinds of chemotherapy that may be used. The chemo may be given in different ways. Some are given by mouth. Others are injected into a vein or in the space around the spinal cord. The drugs travel through the bloodstream to almost every part of the body. Side effects of chemotherapy may include difficulty fighting off infections, hair loss, nausea and vomiting, trouble swallowing, sores in the mouth and lips, diarrhea, skin rash or darkened skin, darkened nails or ridges in the nails, headache or body aches. Other side effects are possible and depend on the medication used. Biological therapy or immunotherapy is treatment used to boost or restore the ability of the immune system to fight cancer, infections, and other diseases. Monoclonal antibodies are proteins that help the immune system find and destroy cancer cells. They are delivered through a vein. Radioimmunotherapy uses radioactive monoclonal antibodies to deliver radiation to the cancer cells directly. Side effects of biological therapy may include headache, weakness, nausea, fever, and chills. In rare cases, skin rash, low blood pressure, and trouble breathing may result. Other side effects that may happen depend on the medication used. Targeted therapy targets specific differences in cancer cells to try and prevent the cells from growing and spreading. Targeted therapy is given in pill form, injected under the skin, or injected into a vein. The side effects vary based on the specific medication used. Radiation therapy uses high-energy rays to kill cancer cells and stop them from growing and spreading. The radiation that treats the cells comes from a machine that aims the rays at a specific area of the body. Non-Hodgkin's lymphoma patients usually receive radiation therapy multiple days a week for several weeks as an outpatient in a hospital or clinic. Outpatient means that the patient goes home after each treatment. Nausea, vomiting, and diarrhea are common side effects, but this depends on the radiation type, dose, and location. Sore throat, trouble swallowing, hair loss, and skin irritation may happen. You may have more severe side effects if your provider recommends chemo and radiation together. Your provider might offer suggestions on coping with side effects. Stem cell transplants may be an option. In this treatment, stem cells are collected from a donor or from the patient, frozen, and stored for later use. If taken from the patient, the cells may be treated to kill lymphoma cells that may be present before freezing and storing them. High doses of chemotherapy and radiation therapy are used to wipe out the bone marrow and with it, hopefully, all the cancer cells. The stem cells that were collected are put back in your body through a tube so that new, healthy blood cells can replace the cancer.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Non-Hodgkin's disease is a type of lymphoma. Lymphoma are cancers that develop in the lymphatic system, part of the body's immune system. The job of the lymphatic system is to help fight diseases and infection. Non-Hodgkin's lymphoma is caused by changes in genetic material. This can happen for a variety of reasons. These changes are sometimes inherited. Changes in chromosomes may also happen as a result of exposure to infections, drugs, tobacco, chemicals, or other factors. Treatment for non-Hodgkin's lymphoma may include radiation therapy, chemotherapy, biological therapy, targeted therapy, and stem cell transplantation. Sometimes a combination of treatments may be used. What treatments are right for you depend on the type, stage, and location of non-Hodgkin's lymphoma, the size of the tumor, your symptoms, age, and general health. Thanks to advances in medicine, non-Hodgkin's lymphoma can be managed with treatment or cured.
Thank you for using Explain.